Welcome to the Dental Podcast. Did you ever think that fixing just like one single chipped tooth or maybe replacing a stained crown could literally be the difference between a senior citizen isolating themselves at home or actively rejoining their social circles?
Yeah, it sounds extreme when you say it like that, but it's completely true.
Right. And so for today's deep dive, we are exploring this massive paradigm shift, one that completely upends how you probably think about going to the dentist, especially as you, or people you care about, enter their golden years. We're really dismantling this whole idea that cosmetic dentistry is just, pure vanity for 20-something influencers.
Which is such an important distinction to make. I mean, right out of the gate, there's this pervasive, almost cultural assumption that once you pass a certain age, aesthetic concerns should just, well, take a back seat.
Right, like you just stop caring.
Exactly. But when you dive into the reality for older adults, you realize that a radiant smile is deeply, inextricably linked to physical health. It's tied to cognitive well-being, chewing function, and just overall quality of life. It's fundamentally about vitality, not just, looking good for a photograph.
And to explore this, we've got a really fantastic stack of source material today. We are looking at the clinical philosophy of Dental. They're a highly advanced practice located at 305 East Rand Road in Arlington Heights, Illinois.
Yeah, and they serve as a major dental hub for the surrounding communities, too. Places like Buffalo Grove, Palatine, Mount Prospect, Schaumburg, and Elk Grove Village.
Yeah, huge service area. And they're open Monday through Friday, 10 a.m. to 6 p.m., which is great to know. But alongside their broader practice profile, we are looking at this specific, fascinating guide authored by Dr. Belis Poles.
Right. The guide is titled Golden Years, Radiant Smiles, a Senior Cosmetic Dentistry Guide.
Yes, and what this guide does is outline exactly what you need to know about navigating your oral health as you age.
And really, the mission here is to arm you with a biological and practical understanding of what is actually possible in modern dentistry today. Because well, the landscape of what a dentist can do has evolved at a blistering pace over the last decade.
Oh, for sure. It's totally different now.
We want you to understand how to evaluate a practice, what underlying biological factors you really have to watch out for, and, how to approach these treatments holistically.
So let's start with the practice itself, because the way Dental operates really provides the context for Dr. Poles' entire guide.
It really does.
What immediately caught my eye about Dr. Poles, who, by the way, brings over a decade of clinical experience to the table, is how expansive their definition of dentistry actually is.
Yeah, they treat toddlers all the way up to seniors who need massive full mouth reconstructions.
Right. But they're doing it with this huge emphasis on a patient-first mentality, plus advanced technology intertwined with environmentally conscious practices.
Which tells you a lot about how a practice views its role in the world, honestly. Being eco-conscious in a medical setting is incredibly difficult.
Because of all the plastics and stuff?
Exactly. The sheer volume of single-use plastics and chemical waste traditionally involved is staggering. So when a practice actively commits to minimizing their environmental footprint through sustainable protocols while simultaneously adopting the highest level of digital diagnostic tech, it demonstrates a macro level of care.
They aren't just looking at the microenvironment of your mouth.
Right. They are looking at the broader impact of their work.
Okay, but I have to hit pause right here. Because as I was going through their practice profile and looking at their list of services, I got genuinely confused for a second.
Oh, how so?
Well, I expect the root canals, the deep cleanings, the implants, but they have an entire wing of the practice dedicated to aesthetic services. And I don't mean teeth whitening.
Ah, yes, the facial aesthetics.
Yeah. Botox, dermal fillers, microneedling, laser hair removal. They even do permanent makeup and intravenous IV drip therapy. I have to play the skeptic for a second here.
Go for it.
Are they just jumping on a lucrative med spa bandwagon? Like, why on earth is my dentist offering me an IV drip and a Botox injection?
It is a completely fair question. And at first glance, it absolutely sounds like mission creep, right? Like they're doing too much. But if you look at the neuromuscular anatomy of the human head and neck, it actually makes profound clinical sense.
Wait, really? How does Botox make clinical sense for a dentist?
Well, dentists are arguably the most highly trained medical professionals when it comes to the complex musculature, nerve pathways, and skeletal structure of the face.
More than a general practitioner, you mean?
Without a doubt. A dentist spends their entire career working within the millimeter-precise environment of the jaw and facial muscles. So think about what happens when Dr. Poles is restoring a senior's smile. The teeth do not exist in a vacuum. They are literally the structural scaffolding for the lower third of the face. If your teeth have worn down over 60 years, your jaw overcloses.
Oh, and that causes wrinkles.
Yes, it creates deep folds around your mouth and thinning lips. If a dentist rebuilds your teeth, they're restoring the scaffolding. Offering dermal fillers complements that by restoring the soft tissue volume that was lost alongside the bone and enamel.
Oh, wow. I never thought about teeth as the scaffolding for your face.
Exactly. The teeth and the face are a unified physiological canvas. And consider Botox. We think of it for wrinkles, sure. But in dentistry, Botox is an incredible tool for relaxing the masseter muscles if a patient is grinding their teeth to dust due to TMJ issues.
So if you fix the teeth, but they keep grinding.
You're going to break the new dental work. If you don't relax the muscle tension that destroyed the teeth in the first place, the whole restoration is at risk.
That is fascinating. What about the IV drips, though?
Well, as for the IV drip therapy, systemic wellness is crucial for healing. If an older adult is undergoing complex surgery for dental implants, ensuring they have optimal hydration and vitamin levels intravenously directly supports faster, more predictable tissue healing.
It is comprehensive wellness.
Exactly.
That completely flips my perspective. It's not a med spa tacked onto a dentist. It's recognizing that the mouth is connected to the face and the face is connected to the whole body.
And treating the whole patient in that comprehensive way brings us right into the core of Dr. Pohl's guide for seniors.
Yes, because society constantly feeds us this really depressing narrative that aging is synonymous with an inevitable, unfixable physical decline.
Right, the messaging is basically you're getting older, so expect your teeth to fall out and expect to eat soft foods.
Exactly. But the philosophy in this text fundamentally rejects that premise.
It does. Dr. Pohl's frames dental decline not as an inevitability of passing time, but as a biological condition that happens to correlate with age. And more importantly, a condition that has highly effective engineered solutions.
The guide emphasizes that cosmetic dentistry for older adults is primarily about restoring function, right?
Yes. The aesthetic beauty is almost a byproduct of achieving perfect biological function. When you fix chipped, cracked, or missing teeth, you aren't just making someone look camera-ready.
You are restoring their ability to chew fibrous vegetables.
And process protein and speak without phonetic distortion.
And the psychological aspect of that is huge. The sources bring up a concept that I found absolutely fascinating. It's this idea of a feedback loop of dental confidence.
Yeah, the behavioral psychology here is incredibly well documented. We often assume that people who have great daily health habits are the ones who get cosmetic dentistry.
Right, like only the people already flossing twice a day go get veneers.
Exactly. But the text suggests the inverse is frequently true. Receiving cosmetic dental work actually instigates better health habits.
So changing the appearance changes the behavior. How exactly does that loop work?
Think about the mindset of someone who is deeply embarrassed by their failing teeth. Human nature is to avoid what causes us psychological pain, right?
Yeah, that makes perfect sense.
So they avoid looking in the mirror. They avoid brushing too closely because it reminds them of the problem. And they definitely avoid the dentist out of a deep-seated sense of shame.
They essentially give up on the mouth. They're locked in a cycle of neglect, fueled by embarrassment.
Precisely. But when you intervene, when you restore that smile and give them teeth, they are proud of you. Shatter that cycle. Suddenly, the patient is highly motivated to protect their investment.
Oh, because now they have something to lose.
Exactly. The text notes that seniors who feel confident about their renewed smiles become meticulous about their oral hygiene. They brush properly, they floss, and they never miss a preventative checkup.
The cosmetic improvement becomes the psychological engine that drives long-term preventive health. I love that.
It's really powerful.
But before we get to the actual cosmetic transformations, there is a massive caveat in the source material.
Yeah.
A non-negotiable prerequisite, really. You cannot just glue beautiful porcelain over a biological disaster zone.
You absolutely cannot. In the dental field, there is a saying, you can't build a castle in a swamp. The underlying biological foundation has to be perfectly stable before any aesthetic work is even considered.
The guide lists several foundational issues that have to be resolved first. Active gum disease and tooth decay, obviously. But Dr. Pohl specifically singles out two conditions that hit seniors particularly hard.
Dry mouth and jawbone loss.
Right, and I really want to dig into the why here. Let's take dry mouths first. On the surface, that just sounds like a minor annoyance, like, you drink a glass of water and you're fine.
Yeah.
Why is dry mouth a critical structural threat to cosmetic dentistry?
Because we severely underestimate what saliva actually does. Saliva is not just water. It is a highly complex, dynamic fluid that acts as your mouth's primary waste management and remineralization system.
Remineralization,
Yeah.
like repairing the teeth.
Yes. It is packed with calcium, phosphate, and specialized enzymes. Every time you eat, the bacteria in your mouth consume the carbohydrates and excrete highly corrosive acid.
And the acid dissolves the teeth.
Right. But in a healthy mouth, your saliva constantly washes over the teeth. It neutralizes that acid and literally deposits calcium back into the microscopic pores of your enamel, repairing the damage in real time.
Wow, I had no idea it was doing all that. So what happens with seniors?
In older adults, salivary glands often slow down. This is largely due to age, but it's also a side effect of dozens of common prescription medications. Things like blood pressure meds, antidepressants, you name it.
So without saliva, that real-time repair system is completely shut off.
Entirely. If a dentist places thousands of dollars worth of beautiful custom veneers or bonding into a mouth that is bone dry, it's a recipe for disaster.
Because the acid just sits there.
Exactly. Without the protective buffering of saliva, the bacterial acid will just pool around the margins of that new dental work. The natural tooth structure underneath will rapidly rot away, and the cosmetic work will literally just fall off.
Oh, wow, that sounds terrible.
It is. A responsible clinician has to address and manage the dry mouth medically before they ever touch the aesthetics.
That makes total sense. You wouldn't install expensive custom kitchen cabinets in a house that has a crumbling foundation and a leaky roof. You have to fix the environment first.
Exactly. Fix the structure first.
So, what about the bone loss? The guide points out that missing teeth lead to the deterioration of the jawbone. I always assumed bone was static, like the wooden frame of a house. It's just there. Why does the jawbone shrink just because a tooth isn't sitting on top of it?
That is a brilliant question, and it comes down to a biological principle called Wolff's Law. Bone is not dead wood. It is living, dynamic tissue that constantly remodels itself based on the mechanical stress placed upon it.
Mechanical stress, like working out.
Yes, think about astronauts going into zero gravity.
Right, they lose bone density because they aren't fighting gravity. The mechanical stress of walking is gone.
Exactly. The exact same principle applies to your jaw. The roots of your natural teeth are suspended in the jawbone by tiny ligaments. Every time you bite down on a piece of food, that force travels down the root and sends mechanical shock wave into the surrounding bone. That physical stress signals the bone-building cells osteoblasts to keep fortifying that area.
So when the tooth is pulled, the bone goes into zero gravity.
That is the perfect way to visualize it. The stimulation stops completely. The body is highly efficient, so it senses that the bone in that specific area is no longer being used to support a chewing force.
And it just gives up on it.
It essentially says, we don't need this anymore, and it begins to dissolve and reabsorb the bone tissue to use those minerals elsewhere. The jawbone literally melts away over time, which gives older adults that sunken-in facial appearance.
That is wild. So how does a dentist even deal with that?
Well, a cosmetic dentist has to evaluate the density of the bone using advanced 3D imaging to see what they're working with. If the bone has resorbed too much, they may have to perform bone grafting to rebuild the foundation before doing anything else.
Which perfectly bridges us into the actual cosmetic toolkit. Assuming the environment is healthy, the saliva is flowing, the bone is solid, the gums are disease-free, what are the actual pathways to restoring the smile?
Right, the fun part.
The guide lays out a spectrum of interventions, and it usually starts with the most common concern.
Color.
Years of coffee, tea, red wine, smoking, and just the natural thinning of enamel make teeth look yellow or gray.
Yes, teeth whitening is the first line of defense, but the text makes a crucial distinction here. It strongly advocates for professional whitening over the over-the-counter strips you buy at the pharmacy.
I was going to ask about that. Those strips are everywhere, and they seem to work fine for some people. Why is professional whitening clinically superior, especially for older enamel?
It comes down to the chemistry of the stain and the safety of the delivery method. Your tooth enamel is essentially a crystalline structure, and over decades, dark pigment molecules get trapped deep inside the microscopic pores of that crystal.
So they aren't just on the surface.
Right. Store-bought strips often rely on abrasive materials to aggressively scrub the surface, or they use a one-size-fits-all concentration of hydrogen peroxide that can leak onto your gums and cause chemical burns.
Ouch. And older enamel is already thinner, so you really don't want to be scrubbing it with harsh abrasives.
Exactly. When you go to a practice like Omnidental, the dentist uses a highly calibrated, much stronger peroxide gel, but they clinically isolate and protect your gums.
So it doesn't burn.
Right. The active oxygen molecules penetrate deep into the enamel to chemically break the bonds of the dark stain molecules, lifting them out without damaging the structural integrity of the tooth. It is a biological chemical reaction, not a mechanical scrubbing.
Which results in a brighter, safer outcome with
Right.
far less sensitivity.
Ex-
Okay, so let's say the color is fixed, but there are structural issues. The guide highlights dental bonding next. This seems like the perfect solution for the micro repairs.
It is incredibly versatile. As we age, teeth get little chips on the edges from years of use, or maybe the gums recede slightly, leaving a small, dark triangle between the teeth.
And bonding fixes that.
Yes. Bonding uses a high-tech composite resin that is color-matched exactly to your tooth.
How does it actually stick, though? If you just glue something to a wet tooth, wouldn't it snap right off when you bite an apple?
If you use regular glue, yes. But dental bonding works on a microscopic level. The dentist applies a mild conditioning liquid that opens up the tiny pores on the surface of the natural tooth.
Okay.
Then they apply the putty-like resin, sculpt it perfectly into the missing space, and hit it with a specialized ultraviolet light.
Oh, I've seen that blue light before.
Yeah, that light triggers a polymerization reaction. It instantly hardens the resin and mechanically locks it into those microscopic pores, fusing it directly to the tooth structure. It's fast, relatively inexpensive, and usually doesn't even require anesthesia.
But what if the tooth is too far gone for a micro repair? Say the enamel is deeply intrinsically stained from childhood medications, or the teeth are heavily worn down and shortened. That's where the guide points us to the third pathway, dental veneers.
Right. If bonding is patching a small hole in the drywall, a veneer is entirely resurfacing the wall.
That's a great analogy.
A veneer is a wafer-thin, custom-milled shell of porcelain that is permanently bonded to the entire front surface of the tooth. Porcelain is phenomenal because it reflects light exactly the way natural dental enamel does.
So it doesn't look fake.
Right. It doesn't look like a flat white chiclet. It
Yeah.
has depth and translucency. It essentially replaces the outward-facing architecture of the tooth, instantly correcting severe discoloration, misalignment, or heavy wear.
And finally, we arrive at the heavy hitters, the ultimate restorative pathway, dental implants. For a senior who is missing a single tooth or even an entire arch of teeth, the guide positions implants as the gold standard.
Without a doubt.
But here's where we hit a massive psychological barrier for a lot of people listening. The guide specifically addresses a frequently asked question. Is 70 too old to get dental implants?
It is the most common hesitation in the field of senior dentistry. And the answer provided in the source material is deeply empowering. Chronological age is largely irrelevant when it comes to the success of dental implants.
Wait, really? A healthy 78-year-old has the same shot at a successful implant surgery as a healthy 35-year-old.
Biologically speaking, yes. The body does not possess a calendar. The biological mechanisms that heal bone and tissue do not just shut down on your 70th birthday. What matters is biological health.
So like how well their body functions right now.
Exactly. If the 78-year-old has controlled blood sugar, healthy gums, and adequate bone density, they are a fantastic candidate.
And how do implants solve that zero-gravity bone loss problem we talked about earlier?
Well, because unlike an old-school denture that just rests passively on top of the gums, an implant surgically replicates the anatomy of a natural tooth. It utilizes a medical-grade titanium post that is placed directly into the jawbone.
Titanium.
Yes, and titanium has a unique, almost magical property called biocompatibility.
The bone actually likes the titanium.
It loves it. The bone cells physically grow into the microscopic threads of the titanium post, permanently locking it in place. This process is called osseointegration.
Osseointegration. Wow.
Once that happens, the dentist attaches the beautiful porcelain crown on top. Now, when that 78-year-old patient bites down on a steak, that mechanical chewing force travels down the titanium post and sends that critical shock wave right back into the jawbone.
It reestablishes the mechanical stress. It tricks the body into thinking the tooth is still there, so it keeps the bone healthy.
Exactly. It completely halts the bone loss. The implant is a true functional powerhouse because it restores the full biomechanical system of the mouth.
And a practice like Omnidental is equipped to do this at the highest level, right?
Absolutely. Whether a patient needs one single implant or an all-on-4 procedure to permanently replace an entire upper or lower set of teeth.
It is just remarkable how all of this connects. We started by talking about Botox and facial aesthetics, and we ended up deep inside the cellular biology of the jawbone.
It's all connected.
But it all points to the exact same conclusion.
Yeah.
You do not have to age the way previous generations did. You do not have to accept pain, dysfunction, or hiding your smile in family photographs. A highly functional, radiant smile in your golden years is completely within reach.
It really is. It requires a paradigm shift in how you view yourself, but clinically, the tools are absolutely there.
It just comes down to finding a practitioner who understands this complex intersection of biology, aesthetics, and overall wellness.
Yeah.
You need a team that views you comprehensively.
Which is the exact philosophy championed by Dr. Poles and OmniDental.
Yes. If you are listening to this and realizing that you or perhaps your parents have been putting off this kind of life-changing care, you can reach out to their Arlington Heights office directly at 847-483-8833 to explore what a custom treatment plan looks like.
And, as we close out today's analysis of the source material, I want to leave you with a broader, perhaps more profound implication of everything we've uncovered today.
I love when you do this. What are you thinking?
Well, we've established the biology. We know that feeling confident about your teeth improves your daily habits. But consider the social mathematics of aging.
The social mathematics. What do you mean by that?
Well, we know that social isolation is one of the most devastating health crises facing older populations today. It accelerates cognitive decline and severe depression.
Definitely. It's a huge problem.
We often see older adults slowly pulling back from life. They decline invitations to family dinners because they can't chew the food being served. Or they speak less in social gatherings because their dentures click.
Or refusing to be in family portraits because they are ashamed of their stained or missing teeth.
Exactly. They shrink their world to hide the problem.
Wow. Yeah.
So, the question we have to ask ourselves is this. If a confident smile makes us biologically and psychologically more willing to engage with the world, how much of the tragic social isolation we attribute to just getting old is actually rooted in simple, mechanical, fixable dental discomfort?
That is powerful.
Could something as straightforward as replacing a failing tooth with modern dentistry be the actual key to keeping us socially vibrant, connected, and present in the lives of the people we love as we age? It is an incredibly powerful thought to consider.